So hello, the first GIEQs Day has come to an end here in the complex room. I think we had a very interesting day today. We had several sessions. So we had a session on plastic stenting in the biliopancreatic tract, one on metallic stenting in the biliopancreatic tract, troubleshooting in ERCP and EOS, endoscopy and IBD, the patient at the center of endoscopic practice, and a final session on radiology for the endoscopist. So I think that during the plastic stenting session, we demonstrated that plastic stent characteristics may determine patient outcome in patients with biliopancreatic disease. And we demonstrated also the placements of plastic stents in the biliary tract and in the pancreatic tract with two cases. For the metallic stenting part in the biliopancreatic tract, we had an excellent presentation on how to use metallic stents for different indications and how to choose the most appropriate stent characteristics. And I think one of the most important messages that I remember from the discussion that we had is that to never place an uncovered self-expandable metal stent outside of the setting of a palliative and histologically proven malignant biliary obstruction. So we had one session also on, it was an expert discussion on how to deal with common and less common ERCP-related challenges, such as a difficult cannulation, which was a very interesting session as well. And then after the EOS and ERCP sessions, we had two sessions on IBD. And in the first session, we learned about the importance of a standardized endoscopic reporting. And we learned that polyps in IBD can be markedly different as compared to classical polyps. And we discussed the approach to the detection and characterization of these lesions. This was nicely illustrated also by a live case. And in the second session of IBD, one of our radiologists gave a nice presentation on small bowel assessment in IBD, and we had a second lecture covering the approach of post-operative complications in IBD. The next session was focused on the role of the patient in our endoscopic practice, and I think the role of the patient is obvious and clear. The patient should always be the focus of our care, and we discussed best practice in this regard and highlighted the importance of, for example, a patient checklist and good bowel preparation in terms of patient safety. And in the final session of the day, Dr. John Curtis gave us a comprehensive training with a case-illustrated overview of different situations where radiologic examinations might help endoscopists in terms of diagnosis, but also in terms of planning of endoscopic therapy and detection and management of post-endoscopic complications. So I think we had a really great day here in the complex room. Was a lot of discussion among experts. Also in the endoscopy room, we had an excellent team of anesthesiologists, and we had the endoscopy nurses with very exciting cases. So I'm looking really forward to the next day. So tomorrow we all meet you again at 8 o'clock and to start the second day of the third edition of GIEQs here in the complex room. Thank you very much.